The views expressed on the following program do not necessarily reflect the views of Money Radio staff, management, or advertisers, and do not represent an offer to buy or sell any securities. Some interviews heard on this program may be sponsored by the participants. It's time for Health Futures with Cypress Home Care Solutions, Bob Roth. This is Arizona's only show dedicated to providing you with expert advice on how to live a longer, healthier, and happier life. To learn more, call 602-264-8009. That's 602-264-8009. Now, here's your host, Bob Roth.
Good afternoon. You're listening to Health Futures, taking stock in you. And it must be Friday. We're on every single Friday. We've been on the air for nearly 8 years, coming at you live from the Scottsdale Air Park Money Radio Studios, 1510 AM, 105.3 FM, and the World Wide Web, moneyradio1510.com. I am here to tell you that James, our engineer, tells me that we're on Facebook Live, and I've never done Facebook Live. And fortunately, I have an incredible guest, but she is coming in remote. She is a repeat guest, an extraordinary guest, because she's out there advocating for older adults, and that's what this show is all about. Our show is about how our older adult population can live a healthier, happier life. And how do we do that? We do that by bringing great guests to the show. So I want to welcome back to the show Dana Marie Kennedy. She is the State Director for AARP. Thank you, Dana, for being on the show today.
Thanks, Bob, for having me.
Well, it's
I
good.
Look forward to it. Discussion.
It's good to have you on, and I got to tell you, one of the biggest challenges that we must be faced with, or our older adults must be faced with, is this election day fatigue. And the anxieties that come along with it, and whether you are for the candidate that is the incumbent or the one that is trying to get the election, Joe Biden versus Donald Trump, it doesn't really matter. Is there a stance that AARP is trying to take in terms of calming their members down?
It's interesting that we're having this discussion about voting and counting the votes. And I told my colleagues across the country when we were on a call right before the election, I said, Arizona is used to this, and 2020 is the year of patience. Every year in Arizona, when we have an election, if it's a close election, we watch the ballots get counted. Last year, 2 years ago, we had a close Senate race for United States Senate. Kirsten Sinema was not declared the winner until 6 days after the election. Election night, McSally was up. Our Secretary of State, who's actually running the election, her race was not called until almost 2 weeks after the election. And the press had actually called the election for her. So, I just recommend people turn off the television, go for a walk. Everything is going to turn out okay. It may not be the person who you wanted to win, may not be the winner, but we are going to have a winner, and we are going to have to unite as a country. But until then, we should just be advocating to make sure all votes are counted before they call the election. And AARP has always called for all votes to be counted before we, say who's going to be the winners and losers. I mean, the real issue is that the press calls the election often. It's not the Secretary of State. There's a process. And so what we're watching right now is anytime we have a close election, the microscope gets shined on our electoral process. So everything that's happening right now, and I have friends across the country asking me, what is going on in Arizona? I said, we're used to this. What happened is everybody who turned in, who received the ballot at home, and they filled it out at home, they didn't mail it in, or they mailed it in pretty close to the deadline, or they dropped it off at the polls. So all those ballots then need to have their signature to be verified. And to make sure that, and if there is any questions about the signature, they can call them and they can make sure that there is the voter that intended to vote that way, and that was the voter who signed the ballot. So nothing is going on that doesn't happen every year. It's just we're all a little anxious, and we all want to know who's going to be the next president of the United States, or if we're going to retain the president of the United States. What I know is whoever it is, AARP will work with them, and will continue to advocate whoever that president is on issues that are important to the 50 plus our members, as well as all people 50 plus.
You know, the nice thing is that, you know, we have this feature, and I'm sure every state does, is that you can check on your ballot to see if your ballot got counted. And, you know, a lot of people are really concerned about that. And, you know, I hear what you're saying about Arizona. And the thing that's really interesting for me about Arizona is that on Tuesday night, the night of the election, Fox News called the election in favor of Biden. And nobody else has called the election. AP has, by the way. They've called it in favor of Biden. But all the other media outlets are still, you know, saying Arizona is up. And they still, all the ballots still need to be counted. But it is interesting. You know, I agree with you. I think we need to turn off the television. We need to take a news diet because just the stuff that's coming across can just cause so much anxiety and so much emotions, and certainly with our older adult population, you know, they're definitely feeling it.
And the other thing I would say is, you know, if you post an article, make sure that you verify that the article is correct. I had somebody, you know, post something about Michigan results and saying that they're scandalous, and the last digits of the website was .us. That's not an official government website. So when you went on it, it looked like the ballots were different than what they were declaring. But when you actually went to click on to see the other races, there were no other races that it was reporting on. And if you scroll down a little bit further, there were no, you know, it was a fraud website.
Right.
And I report it. Like, if you're going to post something that is not accurate, then I'm going to report it to Facebook. I don't know if they're going to take it down or not. But that's just kind of stuff that gets people all riled up. And, you know, I think that right now it would be better if we just posted pictures of grandchildren and puppies and kittens and beautiful sunrises and sunsets, and did, you know, posted things that calm people down rather than cause more division.
I couldn't agree with you more. I'm gonna change topics. You know, so we're
Can
gonna
I just say one more thing real quick?
Sure.
So for people who are experiencing a lot of anxiety, there's one simple thing that you can do very easily, and that's breathing. And just take a deep breath in and take a deep breath out.
I'm doing it right now. It feels
and
so
do
good.
that 5 times, and you won't imagine how it actually decreases your stress just a little bit. And so I did that when I testified for Congress. I, you know, did my breathing techniques, and I was like, and really breathing really does help. So I just encourage people to just remember breathing in and breathing out. It's a little thing that you can do anywhere, anytime, and just releases a little anxiety.
You know, I couldn't agree more. That's a great recommendation. I'm doing the breathing. I already feel better, Dana. Thank you. Thank you very much.
You're welcome.
And especially as we go into the weekend, you know, we still may not know the results. So, you know, do a lot of breathing, take a news diet, focus in on your children, grandchildren, puppies, and anything that can make you happy. We're actually going to get some decent weather this weekend here in Arizona. The temperatures are going to drop back down. Hard to believe we were almost at 100 degrees yesterday. It's like, holy moly.
I know.
One segment down. We've got a lot to cover, Dana. I want to talk about COVID and the rising numbers and what that means. I also want to talk about this month of November. It is National Family Caregiving Awareness Month. It's also National Palliative and Hospice Month as well. So, you know, both of those are very important, but National Family Caregiving is something that AARP puts a lot of information out there, a lot of great tools and resources, and you do recognize those unsung heroes that are making that ultimate sacrifice in caring for their loved ones. So I want to talk a lot about that when we come back. You're listening to Health Futures, Taking Stock in You. I'm your host, Bob Roth. I got Dana Marie Kennedy. She is the State Director for AARP. Stick around. We will be right back.
Now back to Health Futures, Taking Stock in You If you have questions about your own or your loved one's future health care, call 602-264-8009. Now, here's your host, Cypress Home Care Solutions, Bob Roth.
Welcome back. You're listening to Health Futures, Taking Stock in You. I'm your host, Bob Roth, and if you're just tuning in, we're on our second segment. I have got Dana Kennedy. She is the state director for AARP. I've got her here on the show here today. She's not physically into the studio. We're coming in via Google Meet and the telephone line, and we have been talking about a lot of different things. So if you missed the first segment, please go up to our website at cypresshomecare.com. Click on the media button, third button down is radio show. You'll catch that first segment, and you'll catch many, many more. In that first segment, we talked a lot about the election and the fatigue and anxieties that are associated with it. Dana gave us some great tips. The main tip is breathe, inhale, exhale, and be in the moment and take a news diet. Limit your news intake. Play with the kids, grandkids, puppies, anything that'll make you happy, right, Dana?
Yes.
So I want to actually pivot over to talking about the coronavirus. And, Dana, the big thing that you do for all of us here in our community is advocacy. And you've been upfront and very outspoken, and thankfully so, not only here in our state, but you've also testified before Congress back in D.C. Numbers are rising, and they were expecting us to have this second, some may call it third wave. And, I got the data points from yesterday, and you and I had a chance to talk just briefly, but, the number of positive cases, went over 2,000 2 days ago, approached almost 2,000 just yesterday. The number of deaths are going up. I mean, here in Arizona, we've been over 30 and over 20 for the last couple of days. But the big number is this effective reproduction rate known as the R0 number. And, for some reason, the 1.2 number really stood out in my head. And I know that you were very involved. And matter of fact, you were the impetus of putting the long-term care facility task force together for the governor's office. Can you share with us, what does this data mean, and what do we need to do to protect ourselves?
Well, keep in mind that, a lot of the people who live in facilities don't leave the facility, especially if they're in a skilled nursing facility. If they do, it's limited. It's usually for a doctor's appointment. Assisted living facility, that's a little different. And it has differed from facility to facility. And they aren't under the CMS guidelines. So they can follow CMS guidelines, but they can also follow their own rules. It's like somebody's individual apartment. So in our skilled nursing facilities, that's where people need a lot more assistance. And so that means people are touching them a lot more. They're often helping bathe them, groom them, brush their teeth, their hair, get dressed, go to the bathroom. So you have attendants that are living in the community that may not be symptomatic, and they may unknowingly bring COVID into a facility. And if they do not do good infection control, you're going to see it spread like it did earlier in the summer. And what happened is earlier in the summer, we were at a different vantage point. We didn't have enough testing. We didn't have enough PPE. I was, felt like I was screaming at the top of the rooftop at City Hall, even or the state legislature, or whoever will listen to me, saying we have got to get testing where it's spreading and where people are dying the most. So our people who live in these long-term congregate settings are at much larger risk. And keep in mind, somebody could be infected with the virus for 2 days or even longer before they have any symptoms. And so that's a little alarming. So testing regularly, especially right now, is absolutely critical.
Testing regularly, but doing all the other things you talked about, wearing, PPE, and also physically distancing too. I mean, we can't let our guard down.
I think the most important thing that happens right now is these facilities all need to have a staff person on board that is monitoring infection control. And where they've done really well in managing the numbers, if they have a staff person 24/7 that is watching infection control. And so the facilities that are not doing that are probably going to see a spread of the virus in a facility if they don't have one person overseeing it. And because you cannot just go from one resident, not change everything up, and then go to another resident.
Right.
So you can't, and if they're short staffed, which they're reporting short staffed, we are now getting information that most of these facilities, 25% of them, I shouldn't say most, 25% of them are reporting up to CMS that they don't have adequate supply of PPE. That's a red flag.
Wow.
And then 25% of them are reporting up to CMS that they don't have enough staff. So if they don't have enough staff, what if, you're trying to take care of 10 residents? Do you have time to change your PPE from each person? So it's really, it is a large undertaking for sure, and they need as much help as possible. But I think that the federal government needs to put its resources directly into these skilled nursing facilities first.
You and I have talked about this, and you know how I feel about staff and workforce, and we're so challenged with that. Challenged prior to COVID. I mean, we knew from the Paraprofessional Healthcare Institute, the state of Arizona was going to have about 100,000 direct care workforce shortage between now and 2026. That was before COVID. And nationally, that number is about 1.8 million. So now COVID has happened. I estimate, and maybe you concur, and mine is just a rudimentary survey of other home care companies across the nation, about 1/3 of our population that is used to serve is now sitting on the sideline. And they're sitting on the sideline for a couple reasons. One, a lot of them have children at home, and children aren't able to go to school, and they're not able to go to daycare, so they need to be home with their child. Number two, they're scared to death of this virus. They don't want to get this virus, and a lot of them are, and I can tell you with my workforce, I've got a lot of caregivers that are over 60 years old, and they don't want to get sick because they're afraid they're going to die. And then the last piece is unemployment. Some of them are making more money sitting on the sidelines than actually working. So, we have this force that's working against us, this trifecta force, if you would, and that makes it hard in the home care arena, and also makes it hard in the communal living space. So,
Absolutely.
So what I hear you saying is we can't let our guard down. We have to be very, very cautious. We need to be out there in front of this. PPE is something that I know with my agency and many other home care agencies. We've been stocking up. We saw this thing coming. I'm a little concerned that 25% of the communal living situations at skilled nursing facilities are not adequately staffed right now. So that are not adequately staffed or stocked, if you would, with PPE.
Right. And the other thing that is concerning is also just they live in a home with a lot of different people as well, and so, or different generations. So they, their kids could be coming and going. So they're also, even at more risk because of how many people may be living in their home.
So, as we wind down this second segment, and really, I hear the puppy in the background. That's okay. We all experience that. I mean, it's interesting doing these Zoom calls. I'm guessing maybe the UPS guy must be outside or something. But
just have somebody it is. They're out there.
But one of the things I wanted to talk about as we wind down the second half or second segment as we go into halftime is Thanksgiving. Thanksgiving's coming up, and talk about not letting your guard down. What do you and AARP are recommending to these families, what they should be doing around Thanksgiving?
Hey, kind of going crazy. Kona, sorry.
Come on, Kona. Keep it down.
He doesn't usually go crazy, so I'm wondering what's going on there. What was the question again? It
was about Thanksgiving. What do you recommend for our listeners in terms of preparing for this holiday that's going to be in several weeks?
It's going to be hard. I mean, this is going to be one of the hardest Thanksgiving, and people are going to question every decision they make. And so they need to really decide how much risk they want to take. I think what I'm going to do is I'm going to go get a test and time it, and then I'll drive to see my family, and then I'll stay with my family. But I think, some people, there is testing that's readily available. The more tests we get, the better off it is. Even testing is not 100% guarantee, but I think that, if we can have Thanksgiving outdoors, make it limited to just your family, I think we need to keep the numbers very small. Don't let our guard down. We need to get through this. I mean, we were testing about, averaging about 1,000 tests last week. We just bounced up to 2 days in a row, it doubled to now 2,000. So as we head into Thanksgiving, those numbers are likely to double again. And we could be where we were in July, where, I think we were getting up to like 5,000 tests a day and over 100 people dying. So I think that we all need to, modify our holiday plans, unfortunately.
No, and I think it's great advice. I mean, obviously, virtual would be really good. And if you do come together, quarantine, before you do come together, and really be mindful of your vulnerable family members. I mean, let's face it. When you really sit down and you look at it, Dana, the number of deaths that have happened in Maricopa County still is the number's over 2/3 that are 65 and older, right?
Yeah.
So knowing that, I mean, we need to be mindful in protecting our older adults.
Yeah.
Time's flying. I want to devote the second half to really our unsung heroes. The fact that, they're making that ultimate sacrifice for caring for a loved one. So stick around. You're listening to Health Futures. We're at halftime with Dana Marie Kennedy. She's the state director with AARP. We'll be right back.
Being in control of your money provides freedom. Learn how to make it, spend it, and invest it. We're Money Radio 1510 and 105.3 FM.
Now back to Health Futures, taking stock in you. If you have questions about your own or your loved one's future health care, call 602-264-8009. Now, here's your host, Cypress Home Care Solutions, Bob Roth.
Welcome back. You're listening to Health Futures, taking stock in you. I'm your host, Bob Roth, and we are in our second half. And if you missed our first half, I've got Dana Marie Kennedy. She is the state director for AARP here on the line with me. She's not in the studio, but we're using technology. She's coming in via Google Meet and the telephone lines. In our first half, we talked about the election, and we talked about the anxieties and challenges that many of our older adults are feeling. And Dana left us with the recommendation to do breathing. And believe me, I was doing it, and I was feeling better already. So thank you, Dana. And in our second segment, we were talking about COVID and this supposed third wave. I wouldn't say supposed. It is happening, and our R-naught numbers are now at 1.2 here in Arizona. And Dana was talking about the fact that we have many of our skilled nursing facilities that are challenged with PPE already, as well as staffing. And we just need to be heightened about this. We need to make sure we're protecting our older adults who are the most vulnerable and still represent over 2/3 of the deaths that have happened here in Maricopa County. And I want to take this segment, or actually this half, to really pay tribute to the family caregivers out there that are truly the unsung heroes that are making the ultimate sacrifice. And AARP does a great campaign to help those family caregivers, not only campaign, but resources that they have available. And this is where, Dana, I'm so glad you're here on the line with me, because I want you to talk a little bit about some of the things that you're doing, but more importantly, some of the stats, because the data is just staggering. I mean, when you really look at approximately 50 million, it's like 45 to 50 million Americans are making this sacrifice every day to help a loved one be able to maintain some semblance of independence and stay at home. They truly are our unsung heroes. They give up a lot to do so.
They certainly do. And there's over, 800,000 of them, and we have done research that's probably a little dated now, but the majority of caregivers are 45 and older women. and they do provide at least I think 2 or 3 activities of daily living per week for a family member. And this is all care that is often not paid for. Sometimes they have to leave their job in order to care for their loved one, and they just provide a tremendous benefit. But some of the women do leave the workforce, so then that even hurts their retirement security as well. And they do it all because they want to take care of their loved one. And when the journey is complete, I haven't met a caregiver who said I regret doing that. They want to do this work. They also want their loved ones to stay at home. So although we're talking about congregate care, Arizona, we don't have as many skilled nursing facilities as the rest of the country. And a report just came out nationally that more people feel that we need more home and community-based services. And I couldn't agree more. And even though we have our All-Tech system here in Arizona, which means if you qualify for going to a nursing home and the state would pay for it, they want to keep you at home and keep you there longer. So it actually could delay that skilled nursing facility, which is why we don't have as many skilled nursing facilities, because there's not a need. And we're doing, as a state, we're doing a great job, but we still have improvements to make.
The stress that these family caregivers go through is extraordinary. And, the fourth leading cause of death here in the state of Arizona is Alzheimer's. And many of our unsung heroes here in our state are caring for a loved one that has dementia and Alzheimer's. And that just makes things even worse, because the person that they're caring for is a shell of the person they used to be. And the stress that comes along with that is got to be devastating.
Yeah, absolutely. And, there are programs and a lot of resources to help that family caregiver with their journey. And people can go to their local area agency on aging, and they provide a lot of assistance. You can go to AARP and Google AARP and local caregiving resources, and we actually have a resource guide for a few of the counties in Maricopa, Pima, as well as Yavapai and Coconino. And these are caregiver resource guides that you can download. We also have a book called Prepare to Care, which is a great book to start you out, or any place you are in your journey. All the things that you need to think about. People don't think about, I need to have this conversation with my mom. Where is your advance directive? What's going to happen when you can no longer do your finances? Do we have all the legal documents in place? It's a lot better to make these decisions before you need to make them than when you're in a crisis. And that's often when families make these decisions. And, if they did a little bit more preparation and had those conversations, so you can honor your loved one's wishes as far as what they want.
We talk about that a lot on our show, and certainly it's a conversation, not one time. It's one that you have over time, and you should be having these conversations right now, especially, even if you're not getting together for Thanksgiving and you're doing it virtually, check in and really talk about that advanced planning that has been taking place, because we want to know what our loved ones' wishes are. And certainly when you talked about how hard the work is and no one ever regrets it, I like to use the phrase, it's a labor of love. It truly is. I mean, people, do this because it comes from the heart. But you know what the fact is that some data that I've learned from AARP is couples caring for one another 65 and older, when they are not getting assistance from anyone from outside the two of them, if you would, 63% of the time the caregiver predeceases the care recipient, and that's not good. And,
no, it's not.
And just the mental anguish, the physical exhaustion. I say it often. I mean, look, it's hard work, and I want our public, our listeners, to look for and know those family caregivers, especially this month. And for us to, identify them, because a lot of them don't self-identify themselves. That's the challenge, right, Dana? I mean, so many of them don't even see themselves as caregivers.
Yeah.
They're doing grocery runs, pharmacy runs, running mom or dad to the doctors. Guess what? You're a caregiver. Whether you know it or not, you are a caregiver. And
they just say, that's just what I'm supposed to do. Take care of mom, take care of dad.
Exactly. And for us that are, standing by and observing and know these folks, I always like to say, don't ask for help, just do. You know, if you're making a casserole, make two. And just drop it off and say, hey, I have dinner here for you tomorrow night or tonight, whenever you want it.
Exactly.
What other tips can you give for those family caregivers? Because you mentioned AARP, and there's some great resources right here in our community. I'm privileged to serve on the board for Duet, Partners in Health and Aging, and Duet has it's a great social service organization helping a lot of people that are out there. But let's face it, I mean, so many of our seniors are aging alone, and that's what really is troubling for me. When you look at statistically, nearly 1/3 of our population, 65 and older, is aging alone. And now COVID just makes things a lot more challenging because they're not wanting to get out. And then put on top of that, the fact that they're watching TV all day and watching what's going on with the election. So that makes it even worse. And we know that smoking or it's equivalent to smoking 15 cigarettes a day and the depression and anxieties that come along with that. We don't have a simple answer, but AARP has so many resources and so many recommendations for these folks. One of them being breathing, like we did in our first segment.
Yeah, I would also want to just give a plug too. There is a brand new program that we helped get passed, and that's the caregiver rebate program. So if people have made home modifications, added technology, hearing aids, they just a walker, a ramp, all those things qualify for assistance. So if they spend $1,000, they will get $500 back. Up to $2,000 for a couple, they will get $1,000 back. And it's the Caregiver Coalition, Arizona Caregiver Coalition runs the program. And so there's, some financial assistance that people can get, and we know that they need that as well. And
if they needed to find that Caregiver Coalition, Arizona Caregiver Coalition, I can give you the website. It's azcaregiver.org. And Dana, I know you worked really hard on that and to get that through the legislature. So I mean, we need to use those dollars. So if you're listening, that's made available to you. If it's that old adage, if you don't use it, we lose it. So we need to get out there and use it. What a great resource. We got a little Baba O'Reilly taking us out from The Who. We got one more segment. Dana, I want to pick up on some other things that AARP is doing and maybe have some final closing remarks with regards to it being National Family Caregiving Awareness Month. You've been listening to Health Futures Taking Stock in You. I have the privilege of having the State Director for AARP, Dana Marie Kennedy, here on the line with me, not in the studio, virtually in the studio. We're down 3. We got one more. Stick around. We'll be right back.
Now back to Health Futures, taking stock in you. If you have questions about your own or your loved one's future health care, call 602-264-8009. Now, here's your host, Cypress Home Care Solutions, Bob Roth.
Welcome back. You're listening to Health Futures, Taking Stock in You. I'm your host, Bob Roth, and if you're just tuning in, we're in our 4th segment. We're coming at you live from the Scottsdale Air Park Studios. I've got coming virtually through my computer and on the telephone line, I got Dana Marie Kennedy. She is the State Director for AARP. We've had a chance to talk about in the first segment, we talked about the election and the anxieties and challenges that come along with it. In our second segment, we talked about COVID and its resurgence and the challenges that it is putting on our skilled nursing facilities and our community as a whole. We did talk about Thanksgiving and how we might be able to do Thanksgiving in a meaningful way, but we need to protect our elders. And in our third segment, we talked about the National Family Caregiving Awareness Month, and it is really something that I want our audience to be mindful of. There are so many people that don't self-identify as caregivers, and they're enduring so much stress. One of the stats that I shared in our third segment that I actually got from AARP is that couples caring for one another, 65 and older, without assistance from neighbors, friends, family members, or home care agencies like Cypress Home Care, 63% of the time, the caregiver predeceases the care recipient, and that is not a good thing. So, Dana, back to you. We were also talking about resources here in the community. You talked about Area Agency on Aging. I talked about Duet, Partners in Health and Aging. You did remind me during the segment that they've got an extraordinary program, Finding Meaning and Hope. So I really encourage people to, definitely look at Duet as a resource to go out to, and that is Duet, DUETAZ.org. Great resource for other things like grandparents raising grandchildren, older adults, as I shared in our third segment, that are living home alone and don't have access to maybe transportation. That's what we do. I say we because I'm on the board of directors for Duet. So a great resource. But AARP has a great resource too. They're a national resource, but they also here locally have over 900,000 members, and they've got a location that you can find a lot about them, and that's aarp.org. Is there a backslash or anything like that, Dana?
So for caregiving, you want to go to aarp.org/caregiving, and we have a lot of resources there.
And I'm looking at it right now. It is very robust. There's a lot of good stuff here.
Yeah. And then if you're local in the Phoenix area, you go aarp.org/Phoenix. The other thing that I will plug is we're doing, we have pivoted like many organizations, and we're doing a lot of things virtually now as well. So, we were talking about taking a news break. Last night we had the Hip Historian Happy Hour, and we did like a interview and a tour with the person who runs the Frank Lloyd Wright Center. And we did something about the We've done history about the state capitol. Every week it's a little bit different. The person who does it his name is Marshall Shore, and he's considered Arizona's hip historian. We also do Back to the Basics, which is health and wellness, half an hour segments. We're doing them every other week with Coach Sherry Ann. We are also doing Healthy Rhythm drum circles, which drumming is also stress release. You don't need to have a drum. You just need to have a can or a plate or a pot and pan. And we used to do these, in person, but now we're doing them virtually.
I love it.
And we just have tons of things to keep you, entertained, engaged, stimulate your mind. We also have, we will do a lot of plugging with different resources regarding Caregiver Month. And we really partner with organizations. We don't provide services per se. We do provide a lot of content and educational opportunities. I think we have something for everyone. And if we're not, give us an idea of something that you'd like to see us doing, and we'll explore it.
Well, I'm looking at the website, the /Phoenix. You have front and center that Arizona 1000 reimbursement for family caregivers. I really encourage you. We talked about this at the end of the third segment. I'm going to give you an opportunity to plug it again because we need to keep this around, and we need to help these family caregivers. Can you just walk us through one more time what is involved in this reimbursement?
Yep. So it is an income level program. So if you're a couple making more than $150,000, you won't qualify. If you're a single person making more than $75,000, you won't qualify. Everybody below that income eligibility qualifies. So if you do a ramp or buy a walker or a wheelchair or do some home modification, a lot of people are, adding some of the tablets for internet to be able to do FaceTime. They'll reimburse for technology as well as, the services to get that technology. Not all seniors use, broadband, so that might be an option. Call them. They're trying to be as flexible as possible when you are making modifications to keep somebody in their own home as long as possible. If you spend $2,000, you get $1,000 for a couple. If you spend $1,000 for a single person, you are eligible for $500. You just need to keep your receipt, contact the Arizona Caregiver Coalition, and they will be able to walk you through the process to get you a check.
azcaregiver.org, and it's for like bed handles, wheelchairs, scooters, walkers, ramps, widening of doorways, roll under sink. high-rise toilet seats, handrails, hearing aids, Hoyer lifts, anything that is medical and assisted technology, they're going to give you $1,000. You have to do your application and submit it by December 31st. Is that correct?
Correct. Thank you for mentioning that deadline because it is important, and it will continue next year. So in order to get the maximum amount, we believe people are, they're bundling their receipts and then apply to, once they hit that $2,000, then they'll then submit it to be able to get the $1,000. And it's up to $500,000, but we're not there yet because it's a very new program. So let people know if you know that they have made those modifications that they could get reimbursement.
Get the word out there. The threshold of income is $75,000 or less for a single person, $150,000 or less for couples. Dana, we have a little less than a minute. What lasting remarks, or is there a question I haven't asked that you would like to have asked, that you would like to leave with our listeners?
I just want to say I know that these are such challenging times, and we are all being tested, and our resiliency is really being tested. And be kind to people. Don't get on online fights or fights with family members. Leave politics at the door. We don't always have to agree. We don't always have to be right. It's an opinion, and we all have the opportunity to have an opinion. But I think more than anything, we just need to not engage in partisan politics to the level that it's just going to create anxiety and problems with your relationships with other people. It's okay not to talk politics. It's okay to talk politics as well. It depends on what your family likes and, your comfort level. But have a discussion. Be open-minded.
Right.
I think it's really important more than any time ever.
Dana, great recommendation. Thank you as always. Always great to have you here on the show. Make it a great day. Have a great weekend. We will be back next Friday.
There's no place like home. You've been listening to Bob Roth's Health Futures. If you have questions about your own or your loved one's future health care, call Cypress Home Care Solutions at 602-264-8009. That's 602-264-8009. Or visit cypresshomecare.com. Be sure to join Health Futures with Bob Roth every Friday at noon, right here on Money Radio 1510 and 105.3